Each of the speakers will have to unmute themselves, right? You will not be controlling that. Okay.
Yes, each speaker will have to unmute.
Okay, just to remind each of the speakers that you have to unmute yourself when you want to speak. Thank you.
Thank you very much. Good afternoon and welcome to all attendees in Zoom and our viewers via YouTube. This is the 4th session of the ASEAN-IPR discussion series. We will start in about 2 minutes. Thank you for your patience. Excellencies, distinguished moderator, speakers, and guests, ladies and gentlemen, good afternoon. Happy International Day of Peace 2021. Welcome to the ASEAN Institute for Peace and Reconciliation discussion series. This afternoon's session is taking up the theme COVID-19 and peace in the region. The session of the discussion series aims to discuss how the COVID-19 pandemic has caused disruptions to provision of humanitarian assistance, efforts of conflict resolution, and peace building. The shift in priorities from conventional humanitarian assistance to focusing more on healthcare support and vaccine distribution, from face-to-face mediation and negotiation efforts to online mediation efforts, have all changed the landscape of humanitarian assistance and peace efforts. How this has been done and the extent of the success or shortfalls of these efforts will be discussed during this session. Before we begin, please allow me to inform you of some housekeeping rules. During the presentation from the speakers, attendees in Zoom who wish to pose a question to the speakers may use the Q&A box to pose their questions, while viewers on the YouTube can write their question in the live chat box. Please follow the format as explained by the organizer. Please refrain from using the chat or message box function on both platforms for personal or extensive discussions. We ask all participants to be polite and considerate in your messages. Thank you for respecting these house rules. Before we start today's discussion, I would like to invite for a group photo involving the moderator, the 3 speakers, and the Executive Director of ASEAN-IPR. We have the ASEAN-IPR Secretariat on standby to assist in taking the picture. We will count down on the count of 3. Ready? 1, 2, 3. And one more, please. 1, 2, 3. Thank you very much, ladies and gentlemen. Okay, let's begin our webinar. We are pleased to have as the moderator of this discussion, Dr. Darmp Sukontasap, the representative of Thailand to the ASEAN-IPR Governing Council. Dr. Darmp has extensive experience in working in government and private sectors, as well as in the academic circle. He has served as head of the Cambodian desk at the Foreign Ministry of Thailand in the final stages of the Cambodian conflict, which resulted in the signing of the Paris Peace Agreement in 1993. He was in charge of the ASEAN SOM desk and was responsible for organizing the first ASEAN Regional Forum in Bangkok in 1994. He also served at the United Nations in New York as assistant to the first co-chairs of the General Assembly Open-Ended Working Group on the reform of the UN Security Council between 1995 to 1996. In the private sector, Dr. Sukontasap currently serves as chairman, board of directors of Visak Capital Ventures Company Limited. And prior to this, he served as director, CEO, and deputy CEO of a number of publicly listed companies in Thailand. He received his BA in political science from Chulalongkorn University, Master of Arts in Law and Diplomacy, and doctorate degrees from the Fletcher School, Tufts University. He has also attended the Managing Global Business Program for Senior Executive at INSEAD, France. Dr. Darmp was a Fulbright John E. Purifoy and Manuel Elquezon Scholar. He is an advisor to the Standing Committee on Foreign Affairs, the National Legislative Assembly of Thailand. He is also a director to the Executive Committee and the Board of Directors of the Exim Bank of Thailand. Most recently, he was the editor of a 260-page book entitled 50 Years of Thailand in ASEAN, published in May 2018. Dr. Darmp, the discussion is now handed over to you. Thank you very much. Dr. Darmp, you are still on mute. Apologies, sir.
I was the one who was reminding everyone. Okay. Good morning and good afternoon, everyone. Thank you very much, Katika, for the kind introduction. I would like to welcome everyone to the fourth session of the ASEAN-IPR discussion series 2021. Today's discussion topic is COVID-19 and peace in the region. We are very honored today to have with us three very distinguished speakers. Please allow me to briefly introduce each of them to you. Our first speaker is Ms. S. Nanthini, who is a senior analyst at the S. Rajaratnam School for International Studies, or RSIS, Nanyang Technological University in Singapore. Ms. Nanthini is an expert on the topics of humanitarian assistance and disaster relief and non-traditional security issues. Ms. Nanthini holds a master's degree in international relations from the University of Melbourne and a bachelor's degree in politics and gender studies from La Trobe University, also in Australia. Turning to our second speaker, Mr. Alexandre Faite, who is currently head of the International Committee of the Red Cross, or ICRC, regional delegation to Indonesia and Timor-Leste. Having joined ICRC since 1996, Mr. Faite has extensive experience in the field of humanitarian assistance and has held field assignments in Sri Lanka, Afghanistan, Indonesia, and Ethiopia. He was also based in Geneva, New York, and Kuala Lumpur. He was also a head of mission in Yemen, in Mali, and deputy head of mission in Pakistan, Niger, Mali, and Somalia. I hope I have all the countries correct. In Asia, Mr. Faite has done extensive work to promote the adoption of international humanitarian law in national legislations in many Asian countries. He holds a law degree from the University of Liège and an LLM from the University of Essex. Our third and last speaker is Dr. Paul Quinn, who is head of From Violence to Peace at Christian Aid in Ireland. We have more or less forced Dr. Quinn to get up quite early from his bed this morning to join us in this session. Dr. Quinn is an expert in the field of conflict prevention and peace building. He has provided technical, strategic, policy, and programmatic guidance to parties in conflict situations in Africa, Asia, the Middle East, and Latin America. Dr. Quinn has worked for Islamic Relief Worldwide. He was political advisor to the Permanent Mission of Ireland to the UN and a director of the United Nations Messengers of Peace. Dr. Quinn holds a doctorate degree in international relations and lectures on peace and conflict issues at University College Dublin. So that is our three distinguished speakers for today. Without further ado, I would now like to invite each of the speakers to take about 10 to 12 minutes to speak from their prepared notes. After that, we can go directly into the Q&A portion of today's event, where hopefully we can really engage ourselves in a lively discussion and exchanges of ideas among the speakers through the questions and comments from the audience. With such ground rules, I will now invite our first speaker, Ms. Nanthini, to take the floor. Ms. Nanthini, the floor is yours.
Thank you, Dr. Darmp. Hi, everyone. My name's Nanthini, as I've already been introduced by Dr. Darmp earlier. It's really nice to be here today. And thank you to the ASEAN Institute for Peace and Reconciliation for inviting me to speak today. So I think my slide is with Kartika. Yes. If you could go to the first slide, please. Yes. Thank you. Yes, so I'll be, as Dr. Darmp says, I'll be just giving a really short overview of the ASEAN's response to COVID-19. And after that, if anyone has any questions, please do ask them at the in the Q&A function, and I'll answer them as soon as I can. Next slide, please. So disaster governance in Southeast Asia. So there are few, obviously, there are a few definitions of disasters, and the definition I'll be using throughout today's presentation is from ADMIR, the ASEAN Agreement on Disaster Management and Emergency Response. It is, after all, the legal basis for disaster management in Southeast Asia, in ASEAN. And so how it defines disaster is as a serious disruption of the functioning of a society, causing widespread human, material, economic, or environmental losses. So as you can see, this definition is quite broad, and it leaves open the possibility that ADMIR can apply not just to natural hazards, but to other kind of disasters as well. Well, timely now, COVID. Yeah, so disaster governance in the region really only came about strongly after the Indian Ocean tsunami in 2004. That's when the ADMIR was developed and signed, and also later institutions created, such as the AHA Center and the DELSA, its logistics warehouse arm. And so, as you can imagine then, since Southeast Asia is very much, one of the regions, the most the most natural hazard prone regions in the world, there is very much prioritization of natural hazard, which, as you can imagine, is quite understandable, but it has very much led to an uneven development in ASEAN's governance of different disasters. And topically, with pandemic preparedness and response receiving relatively less support and thus progressing a bit more slowly. So this separation from pandemics from natural disasters has culminated in different systems with limited linkages in ASEAN for governing the two types of disasters. Next slide, please. And so COVID-19 in ASEAN. COVID-19 was, as I'm sure most of you know, Southeast Asia was the first was very much the earliest to have a COVID-19 case outside of China, with Thailand, if I'm not wrong, in early January 2020. And so while COVID-19 has been ravaging the region, it's still, as mentioned, like Southeast Asia still has had to deal with natural hazards. For example, last year's major typhoons, Vongfong, Goni, and Vamco, and as well as the tropical storms and floods in Vietnam and Cambodia, all of this, there were concurrent pandemic. While the pandemic was ongoing, natural disasters were happening as well. And so with COVID-19, you already had shortages of medical supplies, particularly the unconventional ones like N95 masks, personal protective equipment, sanitizing products, maybe some of these which weren't quite in stock as much. And also and of course the vaccines, because due to the vast demands and limited production capacity, countries are, as you can see, very much competing for COVID-19 vaccines, with those developed having much more ability to vaccinate their population as fast as possible compared to those without. And so in terms of natural hazards, COVID-19 added this further complexity to the risk landscape of ASEAN, and in particularly the way humanitarian relief was conducted, because unlike in usual operations, these humanitarian actors, stakeholders, responders weren't really able to travel as much and really support the affected governments because of the travel restrictions and all the new normal practices, such as the quarantines. Moreover, most of the COVID-19 guidelines, social distancing, the need for personal protective equipment, they perhaps have not been as high on the list of priorities during this effort, such as the mass evacuation and the sheltering of displaced communities. And of course, in addition, the critical infrastructures that support usually these public health emergencies had already been affected by COVID-19. So you had this both injuries and so on due to natural hazards warring with COVID-19. And of course, vulnerable populations were very much disproportionately affected by COVID-19. In fact, this was one of the big things I think that came up, that really came to everyone's attention, was this gaps in society, was where this already vulnerable people were further affected by COVID-19. And of course, one of these groups were women. And women, they were affected health-wise, as well as socioeconomically, with a lot of women in unpaid care work. So they were taking care of the sick and the elderly, especially those who weren't able to maybe get to hospital in time, and in turn getting COVID-19. Also, stuff like domestic violence, family violence was on the rise all across Southeast Asia, with social distancing measures forcing them in close contact with their abusers, as well as these social distancing measures also affecting crisis centers. So a lot of them were full, and therefore women who needed help weren't really able to get the help that they needed. Also, women who are concentrated in industries, informal work, their economic independence was very much affected as well. And also importantly, the government's measures, I think, to control the spread of COVID-19 disrupted a lot of the provision of humanitarian aid in these complex situations, in areas where there were emergencies happening, where you had the critical services such as prevention of gender-based violence and sexual and reproductive health programs sometimes maybe stopped or curtailed, at least, in favor of the more important COVID-19 pandemic preparedness, those kind of programs instead. And also the public health measures such as quarantines and curfews that were put in place to slow the spread of pandemic very much affected women, in the sense that most of these pandemic controls were militarized. And so this militarization is particularly risky, considering the well-established link between an increase in security personnel and the heightened vulnerability of women to sexual and gender-based violence. Next slide, please. So what was ASEAN's response to COVID-19? So ASEAN both had its usual meetings as well as ad hoc meetings, such as the ASEAN Special Summit on COVID-19. It had these regional mechanisms in place, the AHA Center, for example, which opened its Delha warehouses, its DELSA warehouses for the utilization of its reliefs stockpiles. Items such as mobile storage units, hygiene kits were available to the member state at the request of the various national disaster management organizations. But then these efforts were at the same time not quite able to significantly alleviate the severe shortage of medical supplies in the region, because the conventional stocks of humanitarian aid didn't really meet the specific needs of COVID-19. And of course, you had the establishment of the ASEAN Regional Center on Public Health, Emergencies and Emerging Diseases, where the establishment of this center was very much to create this sort of regional entity to fully coordinate public health emergency management measures. And really its mission was very much to strengthen ASEAN's regional capabilities to prepare for and to respond to these public health emergencies and emerging diseases, which may or may not increase in the future. Fingers crossed, but and of course, one of the main things that came out of ASEAN's response to COVID-19 was the ASEAN Comprehensive Framework. So this was adopted at the 37th ASEAN Summit. And so it serves very much as the exit entry from the COVID-19 crisis. And so what it does is that it lays out ASEAN's response to the different stages of recovery, and it focuses on key sectors. It had like humanitarian, human security, health security, resilience in the future, transport, so on and so forth. And it really kind of set out broad strategies for identifying measures of recovery. And what was quite interesting about this was that it was very much a multi-sectoral approach. And this was one of the things, this was one of the criticisms that I think had been leveraged towards ASEAN at the beginning of the COVID-19 crisis, where a lot of them were saying, okay, ASEAN is very fragmented, its response is very siloed, where is this kind of united approach? And so this was very much that. And what it did, it also left space for adapting according to the situation as well. And yes, and of course it takes into account vulnerable population. It specifies people with disabilities, women, so on and so forth. So next slide, please. And again, I'm going quite fast. So if anyone wants to ask me more, just please feel free to ask me later. So what are the areas of improvement? Or, again, this was a criticism that was leveraged at ASEAN, this lack of regional coordination among the various member states at that time, especially during the early stages, where perhaps due to the different capacities and political needs of the situation, each country was reacting quite differently, where you had certain countries almost immediately embarking on extensive surveillance, monitoring, contact tracing, isolation, and others downplaying the risk of the coronavirus for maybe political needs or so on. And of course, one way to really manage these crises, this public health crisis, this public disasters, was to create ACFED, where the establishment of ACFED was very much a good step in ensuring synergy across the region. And not only that, not only will ASEAN be able to improve its ability to coordinate among the members, it will also enhance their joint capacity to respond to medical emergencies and future threats. And moreover, when you already have, with ASEAN partners already kind of pledging support and investment like Japan and Australia, international buy-in is also evident, and this kind of further cements the whole ASEAN centrality, which is very much tends to be a key concern of ASEAN. And again, this is really to kind of counter the whole ASEAN recommending best practices, policies, and strategies, but don't quite have the legal and institutional authority to enforce them sometimes. Maybe having this kind of regional body would very much kind of keep it on its way and to really kind of live up to the whole one ASEAN, one response concept. And another area of improvement is very much its funding. And so ASEAN's uncertain funding stream due to its low internal funding and high dependence on external donor support sometimes limits its capacity to plan, especially long term. And so rather than perhaps depending solely on this external donor funding, innovative financial mechanisms should also be embraced where necessary. There's been some ideas on crowdfunding, insurance-based mechanisms, blended finance. These are all methods by which ASEAN could potentially take a longer term developmental approach to all these needs. And so, of course, given the clear impacts of this pandemic, there very much needs to be these sort of substantive investments, ensuring that the ASEAN Regional Center on Public Health Emergencies and Emerging Diseases is sustainably funded, mandated, and integrated into the ASEAN community is very much essential. This whole of society approach with the ASEAN Comprehensive Framework and these mechanisms would be the key, in fact, to the success for any response, for ASEAN's response in this region. Next slide, please. And so just as conclusion, so the coordination and integration of different components of regional disaster governance is essential for any form of collective response. And this is as, despite the creation of vaccines, it's very much likely, in fact, it's almost a given at this point that COVID-19 is going to become endemic to ASEAN. And so the risk of concurrent disasters in Southeast Asia is therefore only going to increase, especially with the recent IPCC report, which basically lays out that the region is likely to face an increase in the intensity and frequency of disasters in the region. And so, of course, you also have the various other problems in the region as well. And of course, the next point is that the experience in dealing with natural disasters is very much useful for ASEAN. It can use its whole framework there to kind of use it as a skeleton for dealing with other sorts of disasters, especially pandemic preparedness, such as now. And so looking to the future, in the short term, ASEAN could invest in localized preparedness strategies to empower local actors and communities. Localization has been this big sort of buzzword, and there's been a drive towards it ever since COVID-19 has come about, understandably, of course, because very much a lot of these international organizations weren't able to come as far as they usually would have. And so in the long term, maybe to overall strengthen the disaster resilience in the region and communities, to build shock resistance infrastructure, not just physical, but also in terms of response groups, sorry, enhance disaster risk reduction and build linkages between disaster and pandemic preparedness sectors. Last slide, please. Thank you. And I look forward to your questions later and to hear the presentation of the other two speakers. Thank you very much.
Thank you very much, Ms. Nanthini. That's quite interesting, and I think a very good opener for today's discussion. You also have, aside from identifying the problems that countries in this region are facing, you also presented some recommendations, which of course we can further discuss this in the Q&A session later on. Thank you very much for your presentation. May I now give the floor to our second speaker, Mr. Alexandre Faite from the ICRC. Mr. Faite, you have the floor.
Okay, thank you. Sorry, my camera was off. Thank you very much. I'll try to share my screen, and if I don't manage, then I will ask Ms. Kartika to do it. It looks like it's a bit more difficult than I thought. Miss Kartika, would you help me out and put the presentation on screen? Yeah, thank you. I will need your help because sentences come after one another. So I'll say next each time. Okay, thank you very much indeed, Dr. Sukontasap, for giving the floor to myself on behalf of the International Committee of the Red Cross. Ms. Nanthini, just before myself, has mentioned the concurrence of COVID and natural hazards. Myself, I am going to focus as a complement to this, to the concurrence between COVID and conflict. Okay, so this, but before I do so, maybe in one or two slides, recall what the ICRC is, because the Red Cross family is a big family. So in the family, everybody knows the Red Cross, but it's important to mention that there are three components: the ICRC, the International Federation, and wherever you are in your own country, there is a Red Cross or a Red Crescent society. Okay, next slide, please. With regard to the ICRC, it's a long story and I will spare it for you, but I just wanted to mention then that within the Red Cross and Red Crescent movement, the ICRC was born after the Battle of Solferino and really focuses on situation of conflict and internal violence. This is why in my presentation, I am going to complement what Mr. Nanthini said with this concurrence between COVID and situation of conflict. Next slide. What is the mission of the ICRC? We have a mandate to provide protection assistance for victims of armed conflict and other situation of violence in a neutral and impartial way. This is what we are trying to do. Dr. Sukontasap has recalled my previous mission. So in my previous mission was, for instance, in Yemen. Before that, I was in Somalia, although I was actually living in Kenya, but flying into Somalia and so on. I was in many countries which were experiencing conflict. Next slide. What we do, first of all, is assistance. Maybe go one by one, Ms. Kartika. Yes, thank you. The first one is assistance. Here it's the important part, the most visible, I would say, on TV whenever you have a conflict, is bringing either food, assistance, health relief, water, and so on. Next. But we also do go into prisons, visit detainees, and that sort of thing. So we have a mandate to protect persons deprived of freedom and protect people of sexual abuse, exploitation, and that sort of thing. So it's not only assistance, there is also the important part of protection. Next. What we do as well is prevention, which is basically interact with relevant groups, sometimes some of them a bit violent or very violent, to ensure that they respect humanitarian law and humanitarian principles. Next slide, next one. Cooperation, and here this is, no, sorry, a bit fast, yeah. Cooperation is essential for us because everywhere we are, we work with the National Red Cross or Red Crescent, depending on the country, national society. Here you see somebody from the Indonesian Red Cross, Palang Merah Indonesia, and we have an excellent relationship, as I will explain in a minute. Next. Now, with regard to COVID itself, well, what I want to bring into focus today is it's not all about COVID as we it's an institutional message about the ICRC here that with COVID-19 has amplified pre-existed hardship and suffering, and urgent attention is needed to strengthen health services in conflict areas. So basically, the idea is quite simple. COVID is already bad enough, but as Ms. Nanthini said before, if COVID is on top of it, combined with natural disasters, well, here is the same for conflict. COVID is, we all agree, is already bad enough, but if COVID comes on top of a conflict situation, then the situation is the whole situation becomes really difficult to handle for the people of that particular country. And therefore, this is why the ICRC, we try to vouch for an increased response for countries which are confronted by conflict or otherwise. Next. So here, the importance, therefore, whenever you have a conflict, having a neutral and impartial humanitarian response and humanitarian law, because indeed, if you have polarization, because you have armed groups and that sort of things, of course, you have to maintain a strictly non-political humanitarian response. Next. So the global influencing that the ICRC try to push for is the importance of reaching people in conflict and fragile situation. We have to invest in the health system of these particular places because they are usually weaker than elsewhere. Okay, next. That the vaccination as well is more difficult in situation of conflict. Can you imagine today's situation like Afghanistan? Everybody speaks about it. The situation is bad enough. How can you possibly do COVID vaccination if you don't have a very structured response for this? Next. We need to discuss pretty much what Ms. Nanthini has said with regard to preparedness. We have the same message here. Preparedness needs to be there, especially in situations which may or have been confronted by conflict. Next. Yeah, this one was linked. Thank you. Next. So now I will finish off my presentation by showing a little bit what we have been doing in this delegation. Naturally, this is Indonesia. It's a bit of a I have been in this country for 3 years, and it's a very different setting from the ones I was before. But still, we wanted to remain relevant. Normally, we organize seminars on humanitarian law, humanitarian principles, and so on. And we decided to basically reallocate the whole budget to sort of a pitch in and work with Indonesian authorities, also Timor-Leste, because we cover Timor-Leste from Jakarta. And what have we done in 2020? We have started distributing protection equipment when those were very scarce, as you may remember. And we did this in detention places because, you know, we have a habit of working with detention places, but we have also supported a few partners of the armed forces, from the police. And also we have tried to go what we call the extra mile. We went as far as Papua Barat to do this, to distribute those PPE into prisons. Next. And I am pleased to say that we have also maintained a dialogue with ASEAN on having a coordinated approach at various levels, both ASEAN Secretariat, but also AHA Center, and of course with ASEAN member state wherever we have delegations. Next. So here you see my picture there on the left. Sorry for this, but this is, for instance, what we're trying to do in line with what I said of trying to reach the last mile. The ICRC you will not see so much the ICRC focusing on Jakarta, although we have been working on a vaccination center with the Indonesian Red Cross here in Jakarta. But mostly you will find us in faraway places, places which are difficult to reach sometimes, like in Papua, a bit confronted by a difficult situation. And this map is not up to date because my deputy just came back from Maluku, and there the vaccination program has started, and we are going to go to Papua and back to Papua and Papua Barat to work with the Indonesian Red Cross to really start vaccination over there. So this is the sort of action that we have been doing in a country like Indonesia. I'm almost through my presentation. Next. Here, just a few slides on the lessons learned, as we have been asked by the chair and the MC. First of all, there is no doubt that in something like COVID, and especially COVID vaccination, you cannot work without active support from the government. It's an illusion, I think, to think that even in conflict situation, by the way, humanitarian organizations can really do without the national health system. So here we have been working very closely with the COVID task force. We have seen the head of BNPB, we saw Mr. Erlanga, we saw the Minister of Health, to really make sure that our response is well coordinated, and they have agreed on our scheme of reaching the easternmost provinces. Next. On the picture you see here is one of my colleagues, the health delegate, as we call them, who is currently still in Maluku, I think. This picture may have been taken in Maluku, by the way. We work very closely with existing and new partners. And here, in the Red Cross movement, the main partner is always the National Red Cross. And here, I'm really happy. We're very lucky to have a partner like the Indonesian Red Cross and its huge, massive, absolutely stunning network of volunteers. A little bit of help from the ICRC, and we work together where basically PMI does the bulk of the work. I have to be honest with you here. Okay, now we have to focus on opportunities, and we don't try to replicate. We listen to the PMI. Of course, we listen to PMI headquarters. I'm seeing the Secretary General tomorrow morning, but we also listen very carefully to people in Ambon, in Nusa Tenggara Timor, and so on, because they know their problems, and sometimes they're not the same from one province to the other. And for instance, in Papua, the situation is a bit more complex, and we'll have to adapt. Next. And of course, all of this, I was explaining to Papuja at the beginning that I just finished my quarantine coming back from overseas. Of course, we do this in the full respect of national restrictions, health protocol, vaccines requirements. So rest assured, naturally, that my colleague who is now in Ambon, this is done in full transparency, but also notification to the relevant authorities. Next. And I think this is finished with a few reference in case you'd like to know more, and we can send you information. And for this, I return the floor to you, Bu Kartika, and look forward to any question that you may have. Thank you very much.
Thank you very much, Mr. Alexandre Faite. That was, again, another very interesting presentation. You have made quite a few very interesting and valid points. The first one beginning with the statement saying that COVID-19 has actually amplified the pre-existing human hardships and suffering. You also mentioned about the need to have preparedness in place, which is similar to what Ms. Nanthini was saying. The third part is very much unique to the efforts of the ICRC, which is the last mile services to ensure that the policies are being implemented. The fourth one is you spoke about the partnerships, especially the local partnerships, in order to find out and be able to respond to the unique needs of the local people. So again, those are very interesting points, and I'm sure there'll be a lot of questions and exchanges of thinking later on. So thank you very much. I would like to pass the floor to Dr. Paul Quinn, our third speaker for this afternoon, or rather this morning. Dr. Quinn, the floor is yours.
Thank you very much, Dr. Darmp. So I'd like to start just by thanking yourself and by thanking the Institute for Peace and Reconciliation for inviting me to this, what I think is a really important discussion around peace and conflict and the impact of COVID-19. And I think, when we have these discussions, it's really important for us to reflect, on the impact this could have more broadly, but I think to reflect on the situation of the world before we entered into the pandemic. And I think that when we see the kind of trajectory in terms of the impact of COVID-19 on poverty, which represents one of the key root causes of conflict and a real driver of conflict, I think that the kind of statistics and the projections are extremely worrying in terms of the impact that this will have in the coming years. So if I just go on to the kind of perspective before COVID-19, I think it's really important that we capture that the picture was not perfect for peace and conflict before that, In the last 5 years, more countries have experienced violent conflict than at nearly any time in the last 30 years. And there are projections that 2/3 of the world's poor will live in conflict or fragile contexts by 2030. So that's within the same time frame as the SDGs. And since 2010, major violent conflicts events have tripled. And that's very often due to recurring or protracted crises. And we've seen that in 135 different countries, there have been conflict recurrences or unresolved grievances really bubbling back to the surface. And what this represents is, a conflict continuum where there are challenges for ripeness, for mediation, where there are continuing mutually hurting stalemates between parties to conflict. But beyond that, I think there's inherent impact for peace building and conflict prevention in terms of the exacerbation of COVID-19. So in my role, leading the peace building and conflict prevention work of Christian Aid across 28 countries, we see an inevitable overlap between the humanitarian development and peace building work. And I think that that's something that's been really key for us in terms not only of our response to COVID-19, but in delivering, what is needed by the community and to support the kind of role of the state in delivering peace. So there's a number of emerging trends that we've seen, and I think there are macro trends, kind of international trends across the sector, but there are contemporary trends in terms of how we, influence peace, but these are deeply affected by COVID-19 as well. I think some of my colleagues have already mentioned the closing space for civil society and the challenge that there has been for implementation on the ground, not only for international NGOs, but for civil society groups, and to build that link between the state and the people. And I think that we've seen, civil society space has been closed, repressed, or obstructed in 111 countries across the world. Figures show that only 4% of the global population live in countries where civic society space is open. And so over the last 20 years, we've also seen more than 140 governments adopt counter-terrorism legislation that shows a really worrying trend towards securitization. And that's something that's continued throughout COVID-19 and throughout lockdown, with varying degrees of implications, both within ASEAN, but in the broader international community. I think that we've seen that securitization approaches have not worked, and we see evidence of that. If we look at Afghanistan, where we've seen more than 20 years of intervention in terms of securitization kind of interventions, and more than $2 trillion spent, but yet that hasn't contributed towards sustainable peace. We've seen the war on drugs has essentially failed, where it has not addressed the root causes or the drivers of conflict and how that impacts vulnerable or marginalized communities. And so what we're seeing is really that the trend across the sector is not for more comprehensive peace agreements that address the root causes of conflict and fragility that have been, enhanced by COVID-19. But that really what we're seeing is a trend more towards securitization, which can work to further marginalize vulnerable groups and really reiterate conflict over time. So when we look at cases like, Myanmar, we've seen that there's been political change. We've seen upsurges in violence, in terms of political demonstrations and the role of the state in addressing that. And this has really undermined the COVID-19 response. But I think it also has created challenges in terms of information, what is trusted between what the state is saying, what people are saying, and the role of medical professionals within that. So I think beyond that, when we look at how the pandemic has affected our particular kind of peace building and conflict prevention work, well, I think there's a number of key ways or key impacts that it's had. Obviously, the first line impact is in terms of a public health crisis, which has compounded the kind of psychological impacts of conflict, but has also had an impact on medical facilities and infrastructure to work. The second line kind of impact has been around economics. It's disrupted livelihoods and informal economies, which particularly in borderland areas have a real impact for peace building and for the alleviation of conflict. And the third kind of has been, the third impact has been really specifically around peace and conflict in terms of demonstrations, broader absence of social cohesion within states, where we've seen some civil unrest, where we've seen a lot of misinformation or fake news around the pandemic, but also we've seen the targeting and killing of human rights defenders across the globe, which has been further exacerbated by lockdown, where human rights defenders have been more easy to target. So we see that kind of fragility has been driven, on a societal level, but also through economics and health for that longer term impact. Beyond that, as some of my colleagues have mentioned, there's also been, the role of the state, or the consolidation of power imbalances, as I would put it, where we've seen takeovers during this period, for example, in Afghanistan, or the political change that we've seen in Myanmar at this time. But we've seen in other regions of the world, such as Colombia, where the president governed by decree, so without any parliamentary debate. So that's really shown a shift in the kind of dynamics that we see on the ground. We've seen the limitations of the global system. So the call by the UN Security Council and Secretary General for a global ceasefire was only taken up by certain groups. So we've seen, for example, at that time, the Taliban offered ceasefires only in areas affected by under its control, but not under government controlled areas. And so really the impact that the Security Council was able to have for peace and security during lockdown was relatively limited in those kind of things. But we've seen the broader kind of root causes of conflict, like falling revenues, heightened inequalities and political unrest, as well as what I'll go into in a moment, the wave of gender-based violence that we've seen on the ground. So in terms of implementing a global peace-building strategy, our role has been to mitigate, or to minimize, mitigate, and adapt. So to minimize actions that could further proliferate COVID-19. So that meant pivoting in terms of our peace-building or conflict prevention work, using our peace-building modalities, for example, like peace radio and these kind of things that were not face-to-face, but to adapt and begin to communicate messages around social distancing, around hand washing, respiratory hygiene, to make sure that people in the most vulnerable, fragile, or hard to reach areas were getting accurate, good information that further reinforced the role of the state in terms of communicating the messages that they wanted to reach, and ensuring that that was done through trusted leadership structures at the local level to make sure that that built those connections. We also wanted to mitigate the impact on vulnerable groups, so to support women and victims of gender-based violence, but also to adapt as an organization to ensure that we had business continuity, for want of a better word, and to make sure that there was contingency planning in terms of the impact of COVID-19. And I think that that has been really crucial because it's meant that we've needed to pivot in terms of the more deeper context, conflict, and gender sensitive analysis to make sure that interventions are conflict sensitive and respond to the needs on the ground. I'll go into this in just a moment, but I think that the trends that we've also seen around gender-based violence, we've seen considerable tensions within communities, and the impact has been specifically on women at a disproportionate level. And we've seen greater psychosocial support needs. We've seen the need for greater referral pathways for cases of GBV. But I think as an organization, we've also seen the psychosocial support and mental health needs in relation to peace and security have escalated through COVID-19. And that's been really reflected in our work and our work with the UN Peacebuilding Fund, for example, that's really supported that, and the calls by the UN Secretary General on mental health and the impact of conflict. We've leveraged the role of youth considerably, and that's been youth religious leaders from all different groups across society, but also using youth as a means to communicate accurate information, to tackle and challenge hate speech online. Because we've seen that there's been kind of the repeated kind of discrimination, or it has intensified perceived or stereotypes of groups within different countries, especially by conflict. And youth have really worked as peace multipliers in that way. So leading smaller projects that reach large numbers of people so that it's quite high impact. But like I said before, we also have seen the kind of human rights defenders being targeted, where just last year, we saw 331 human rights defenders were murdered in 2020, and 25 of those cases were in the Philippines, for example, which is a member of ASEAN. So there's a real risk that the human rights defenders who are defending economic, social, and cultural rights and the right to land or the rights of indigenous groups are being undermined. And I think that that has been something that's been a real increased trend that we've tried to adapt through or tried to address through self-protection measures, training for civil society groups to protect themselves. And I think it's meant pivoting our peace building and conflict prevention work, like I mentioned before. So using our existing peace building work to adapt and communicate messages of accurate messaging around COVID-19, to address the stigmas and myths around the virus, and to ensure that that's done quite effectively. And then if I just go on to kind of the last kind of intervention that I wanted to make around this is really around the opportunities and lessons that we've learned from this. And I think one of the key things that we've noticed is around innovation, because the traditional modes of peace building or the traditional modes of development or humanitarian has changed as a result of COVID-19. So we've needed to adapt, use new technologies, but also for peace building, adaptation has meant using technology like machine learning, like natural language processing algorithms to tackle hate speech, to communicate messages of peace. I think that we've seen the increased importance of locally led and inclusive responses. So localization has been key to our mandate, working through local partner organizations who are embedded in local communities. But I think beyond that, we have to go to ensure there's a decolonization of the aid, to make sure that local communities are given the autonomy to determine the kind of interventions they want, what that looks like, and to move forward beyond that, to give them adaptability, because we know that conflict-affected contexts are changing rapidly, that COVID-19 has placed additional pressures on them. So they need to be able to adapt, and that requires flexible long-term funding from international donors, but also it requires a great deal of cooperation between international NGOs, between government, and between communities. And I think that we've seen the incredible role that local communities have been able to do using traditional peace infrastructure or conflict resolution mechanisms to counter divisive narratives or misinformation, but also to build trust between state agencies like the police and with communities, which has been really critical at this time. I think crucially, one of the most important things and the opportunities for us is to build back better, both as INGOs, but as government agencies and as civil society. And that means closer cooperation. For the international NGOs, I think this means working beyond silos, so working across the peace, humanitarian and development work to make sure that that's interlinked and really addressing challenges at the macro level, but also at the very local community level to deliver on the 2030 agenda. And, I think to close, there's many things that we can draw out later in the discussion, but I think there's a really interesting quote by W.B. Yeats, an Irish poet, actually, that said, "Peace comes dropping slow." These things cannot change overnight, but it is about approaching things in a much more inclusive way, in a much more integrated way, and in consultation with local governments and national governments to make sure that we are delivering the needs for local communities. And I think that that's one of the great things that COVID-19 has taught us in terms of adapting and pivoting to be more effective. So I'm very happy to discuss all of this further in the Q&A. Thank you.
Thank you very much, Dr. Quinn. It is quite interesting that you came from the angle of the SDG, and you're looking at the not only from the perspective of at the national level, but also at the societal level, and then you came up with quite a few recommendations that we can talk about later on, such as on innovation, the the importance of supporting localization, strengthening the role of women as domestic violence increases, and then the promote cooperation and coordination in addressing the problem. And also the most important thing is to divert the resources that is needed into fighting the immediate threats of the health emergency, and of course long-term funding. All of this, actually there's a lot of cross-cutting issues among what the three speakers has mentioned. So I think, Katika, is this a good time for us to go directly right into the Q&A session?
Yes, Dr. Darmp, you may proceed with the Q&A, but you may also do some follow-up questions with the speakers if you wish to, like go into depth of some of the points that they have raised. Thank you very much.
Yes, definitely. Thank you. So do we have any questions? I will give a few seconds for questions to come in from the floor. But at this point, as Katika has suggested, let's do some follow-up questions to what our speakers has mentioned. Let me start with Ms. Nanthini and the points that she raised. I'm sure that Ms. Nanthini, I'm sure you're also interested with what Dr. Quinn has mentioned about the increase in violence, especially with women. And in fact, it's a recurring theme because Mr. Faite has also mentioned it too, which is something quite interesting. Do you think that what is happening right now in the ASEAN region, you raised some questions about the problem that arise after the pandemic came about. Do you think that ASEAN currently has enough mechanism or the tools that it's needed in place to do the job? You mentioned about ACP, HEED, AHA, DELSA, and all this. Are they working in a manner that they should be working?
Yes, I mean, in the sense of the AHA Center, DELSA, and all that, they do what they are supposed to do, which is kind of to like support national governments in help in dealing with COVID-19. So in the sense of domestic violence, that tends to be much more of a local problem. That's much more of a national problem. I mean, of course, there are regional kind of mechanisms that sort of, I guess, address this, and the most well-known is, of course, the WPS agenda, the Women, Peace and Security agenda, and that in that you do have ASEAN kind of. ASEAN does very much sign up to that. In that say, I mean, if I'm not wrong, they did have like a joint statement on promoting women, peace and security back in 2017, if I'm not wrong. Yeah. So in that sense, ASEAN does, of course, raise these, have mechanisms in place to deal with domestic violence, to deal with gender-based violence on a broader scale. But of course, individually, that's when the problem comes. Like, for example, one of the pillars of the WPS is, of course, participation. And what that refers to is having women at all levels of decision-making in the various sectors, from government to humanitarian organizations, horizontal organizations, lateral organizations. So that has been a priority for ASEAN. I mean, if you look at the ADMIR work program, the most recent one, yeah, if I'm not wrong, that is one of their main priorities, one of their main strategies to actually increase women's participation. But in terms of, let's say, sectoral problems, in terms of the decision-making stage, in terms of that, women still tend to be heavily underrepresented, especially in senior level positions. So, like, I mean, for example, the underrepresentation in women, especially in terms of, let's say, Southeast Asia's law enforcement or like military, which has been carrying out a lot of this COVID-19 protocols, which have been enforcing a lot of this COVID-19 protocols, the underrepresentation is quite stark. I think you have ranging from 6% in Indonesia to 22% in Laos. What it does is, because of this underrepresentation, there's also the increase for harassment and extortion when it comes to women's interactions with them. So it's not just violence, as in physical violence, but there's also these forms of violence as well. And so during this kind of public health emergency, this can very much be a life and death consequence, because there's this poor understanding of women on the ground. So I guess governments really at this point should really try to create or maybe intensify their support, which includes the adapting of existing care and support services to address these new restriction of movements, and to ensure this service provision, such as the prioritization of gender-based violence cases. Like an example I gave earlier was that the social distancing measures meant a lot of the crisis centers, a lot of the safe centers, they were unable to maybe help as much women as they did beforehand. So like maybe governments could support these organizations more. I mean, there have already been private organizations, Holleback in Jakarta and Aware, of course, in Singapore, where they have kind of instituted new services in place. For example, if I'm not wrong, Aware, they recently, not recently, last year, they implemented this text helpline because a lot of these women are now forced into close contact with their abusers. They aren't able to call. So things like that, like governments could perhaps support more of this, because at the regional level it exists. There are provisions in place. It's the implementation, it's the translation into the local levels, into there's more government. That's where I think some of the problems lie. Yeah.
So aside from amplifying the existing, the pre-existing problems that we have in terms of the social problems, especially on women and children. Has COVID-19 actually served as an obstacle for the governments to invest more effort into this area?
I mean, in the sense of COVID-19 has meant that a lot of resources, a lot of humanitarian resources have been pushed into COVID-19 related operations. Like, I'm sure my two other speakers, they would definitely know this. So a lot of other programs are being maybe shortened or postponed because the funding is kind of delegated to the COVID-19 side. So in that sense, yes, COVID-19 has proved an obstacle, because what it's done is that, for example, the camps in the Rohingya camps, for example, there has been the gender-based, the sexual reproduction, the critical sexual aid programs. Those have been curtailed in favor of maybe the more urgent COVID-19 problems, for example. So in that sense, there is it has deprived women of this kind of vital healthcare. And I guess in terms of what I would say really one of the main issues is this sense of women very much as as a sort of vulnerable population, as in they are, but they're very much only thought of in like ANMIR, for example. It does talk about, you know, improve regional and national capacities for disaster response, but it still only looks as women as a part of the region's vulnerable populations rather than as active individuals for agency. Again, there has been that realization where there's women are also active participants. They are the agents of change. This is something that I'm sure like everyone knows about this, especially in peace and conflict studies. Women as agents of change, women as agents of peace. This is a kind of concept that's now very much present and should be kind of, I guess, driven forward more. It's just in those frameworks that tend to be a bit more of, okay, women are vulnerable populations. Okay, cool.
All right. Thank you very much. Let me move on to our second speaker. For this first round, let me ask each of you one question each, and then later on, I will try to throw in a question that is more general for all of you. And for any of you who wish to address the question that I put forward, please do so. So it will be more spontaneous in that way. But let me complete the first round first, because we'll still have a bit of time. For Mr. Faite, we have a question from the audience, which is pretty much in line of what I have in mind. How, since you work quite a bit on the ground, are governments, in your thinking, are governments doing enough to ensure that the assistance, especially those coming from third parties, would go into the hands of those people who need them, especially you mentioned about the need for vaccination. You mentioned about the need for last mile services. Are governments doing enough from what you're seeing right now? Your colleagues, you showed us some photos of your colleagues who are actually doing the work with the local people. What kind of feedback are you getting at this point?
Okay, look, Indonesia is a bit different from other missions, because my colleagues in Maluku, there is no conflict in Maluku. So perhaps I will focus on a situation like Afghanistan, which is there really you have a hard conflict going on. I chose Indonesia because this is the country where I am, but I think it would be more illustrative to speak about what we do in Afghanistan. There are two elements, I think, in your question and in the question of from the audience. It's whether they can, or the authorities can, and whether they want. Okay, and these are two different issues, because the first problem is that authorities in a country confronted by armed conflict usually are in a very difficult situation. Can you imagine? They are already facing a conflict going on, and all of a sudden they have this pandemic which is coming. So even if they want, they may not be able. Okay, so that's the first case scenario, whereby a particular country, a particular government in a country is not in a position to reach all areas. It would want to, but it cannot. And then this is, I would say, the easiest case, whereby the international community, the national from Red Cross, Red Crescent Society, the UN world will sort of unite, and we work together to do this. Now there is the situation whereby, because one area of the country is controlled by one particular group and so on, and then therefore there are some political elements, and whereby the authorities are not very much supportive of doing this, because they fear somehow that it could help It could help the armed groups, which basically they are fighting, and this is where the neutral and impartial element of humanitarian aid is important. And I did mention it in my presentation, and this is why the Red Cross and Red Crescent movement, but not only, and many other organizations really push to uphold the neutral, impartial, and independent nature of humanitarian aid, so that aid can reach all the parts of the country, irrespective of what people are in it, and whatever authorities is able to control at that moment. And it's not always easy, as you can imagine. There are resistance. The military is usually quite careful when it comes to allowing humanitarian organizations to go into an area which they do not control. So I would not say, Dr. Sukontasap, that this is easy, and I would even say that not enough is done in most cases. I think if we think of the situation of conflict today, you will hear that there are calls to do more and so on. But at least the importance to uphold humanitarian aid in a neutral way, impartial way, and whenever there is conflict, this is utmost important, to sort of push aside politics and say, okay, there is a conflict, but here we have a pandemic situation. We should forget about this to ensure that all people from that particular country have equal access. And when I say equal, it doesn't mean equal, because as Ms. Nanthini has said, well, some are more vulnerable, including women, children, so perhaps they need even more than others. But at least it should be, help should be based on needs and not based on politics. And this, I have to say, is not always easy in a conflict situation. Thank you.
And thank you very much. And how ICRC, in a way, serve as the delivery mechanism for international assistance into the hands of those who need them? How can you assure the international donors that whatever they provided would reach the people who would need them?
Look, we can never promise that it will reach everybody, because this is a promise I would never make. We do our best. We do our best, and we do it with all the energy. So this, I don't want to promise something we cannot reach. But what I can promise you, however, if you were our donor, is to say, whatever we will distribute, whatever we will give, we will do it in conformity with our principles of impartiality, neutrality, and independence. And I think here, our donors, that over the years, I suppose we have managed to convince them that it would not be otherwise. Maybe we will not reach everyone, but all those that we will reach will be assisted exclusively based on their needs in an impartial way. And some of them may get more assistance because they're more vulnerable. But if they get more, it's because of their needs and nothing else. Thank you.
Thank you very much. Let's turn to our third speaker, Dr. Quinn. Dr. Quinn, in your presentation, as I have mentioned earlier, you specifically linked what you're saying to the SDG. So there's a strong linkage that you attempt to establish between SDGs, how to fulfill them, and the overlapping humanitarian and peace-building aspects, which is pretty much the topic for today's discussion. That is, how is COVID-19 actually affecting peace in this part of the world? So, and because of that, would you like to elaborate more on how you see whether or not, and this is pretty much in line of what I have asked Ms. Nanthini as well, whether or not you see that COVID-19 is actually hampering the efforts, the international efforts to bring peace to this part of the world and to other parts of the world as well? Because you did mention other regions of the world.
Yeah, I think that this is a really complex question. When we look at the SDGs, I think that these are global goals. But if we come back to your previous question, there is also a broader conversation that needs to be had at the international level around vaccine justice, where we have seen large wealthy states buy up the majority of the vaccines very quickly, and that increases vulnerability in other areas of the world. I think, when we talk about issues of fragility, for example, that gives the impression that a state is weak. A state and national governments are not weak. They have very strong structures in place, formal structures, and I think that requires more integrated policy responses that take into account the needs of the most vulnerable on the ground. My colleague from ICRC was mentioning, borderland regions are very difficult to access. And I think the role of INGOs is exactly like he mentioned. We work on the basis of impartiality and neutrality, the core humanitarian principles, to ensure that there is access to the most hard to reach areas and that the needs of the most vulnerable are being addressed. When we consider the SDGs, I think that we have to look at peace as a cross-cutting issue, and that requires, responses in terms of security sector reform to build that relationship between military or police and communities, and particularly in conflict-affected contexts, that isn't always the case. And in Afghanistan, if we take the example, regions that were previously, before the recent events, regions had different power actors. So there were areas where the elected government held control and areas where the Taliban held control. And obviously the situation has changed a lot, but for the people on the ground, they respond to the authorities in the area. So I think across ASEAN and across the globe, I think that piece of work is still very much behind and needs to catch up to build the trust between communities and the police, and to make sure that there is access to medical services for everyone, regardless of ethnicity, regardless of gender, and regardless of where in a state you might sit. So to turn then to the second kind of point to the question, around, is COVID-19 hampering peace-building efforts? I think COVID-19 is hampering efforts across every sector. I don't think we can limit that to peace. I think that at the beginning of my presentation, what I wanted to show was that actually the peace environment internationally in the space for civil society was very small and closing before the pandemic. And really what we've seen through lockdown, through successive states of emergency, or through, very rigorous policies that states felt that they needed to implement, is that space has closed further, and that the connection between people and the state is maybe a little bit more detached. And ultimately, that does pose a barrier to peace, because for social cohesion, we need the needs of the most vulnerable to be addressed, for them to speak to power actors, and for policies to be responsive to them. But where that connection and that dialogue doesn't happen, then the social cohesion kind of separates a little bit. And that doesn't mean violent conflict or anything like that. It just means that there are levels of mistrust within local communities or within municipalities or within a state that need to be addressed. And that's something that can be done, but it needs to be done in cooperation, in close cooperation and working together to make sure that that's achieved. I think the main goal of the SDGs is to leave no one behind. And I think that, ultimately, COVID-19, the response to that, particularly the humanitarian response, aims to address that. But this is a long-term challenge that will take many years. And in terms of the connection with peace, I think that requires continued investment, continued work with local leadership structures, with faith leaders from all sectors of society, from leaders within government and from leaders within the defense forces. And that's something that can build, I think. It just requires a coordinated response.
Okay, thank you. The reason why I asked about what you mentioned about the SDGs is because most countries would pledge their support for the SDG. And then immediately, and then suddenly came COVID-19. And what most of you have been saying is that because of COVID-19, we see the amplification of the pre-existing problems. We see the worsening of the pre-existing problems. So does that mean that when people say that, when governments say that they throw all their support behind the SDGs, it doesn't seem that we are seeing that, and especially because of COVID-19, it shows that we are still lacking far behind the promises that governments made. So is that something that that is along the lines of your thinking as well?
Yeah, I think from my side, that does align with my thinking. And I think it's because we've seen this increased securitization, which drifts away from the promises of the SDG really. And, we need to think of the SDGs as mechanisms to build a stronger society where, we have human rights, where there is peace, where there is the humanitarian needs are addressed, and where the development needs and infrastructure and livelihoods and the economic goods required for a strong society are addressed. And what we're seeing in many different contexts across the globe is that there is this increased focus on securitization. And that doesn't address these needs. That moves away from the promises of the sustaining peace agenda. It moves away from, the kind of the promises from the World Humanitarian Summit and the new way of working and all of these kind of global approaches and global pledges. Securitized approaches ultimately, address symptoms rather than root causes. And I think that requires, to address root causes requires a long-term investment and a long-term, commitment to build peace, to address those humanitarian and development needs. And I think that very often decision makers forget that requires a long-term investment. And the kind of temptation to move towards securitized approaches can be all too enticing, but ultimately history and even very recent events have shown us that does not work. So I think that pivot is something that needs to be done, and to be done more forcefully, I think.
Okay, thank you. I now have a question, which is pretty much for all of our three speakers. It is actually something that was raised by Mr. Faite and Dr. Quinn about the need to leverage or empowering the youth, but also the local communities in their efforts to deal with not only the pandemic, but also the rise that we see in for example, domestic violence, in terms of the inequalities in the society. I would like to hear your views on this. When you talk about empowering, when you talk about leveraging the youth and the local community, how do we go about doing that? How can we do something that is more effective than what has already been done? Who would like to address this question?
I can start if you want, Doctor.
Yes, please.
Look, localization has been on the agenda and has been a bit of a buzzword for quite a while. And perhaps too much has been sort of pushed or said about it. I have mentioned localization in my presentation, and I'm deeply convinced that this is the way to go. But perhaps at one point, there is always this swing of the pendulum, whereby maybe in the 80s and 90s and the early 2000s, big international organizations were really working a bit too much on their own. And then the pendulum swung back, perhaps in the last very recent time, back to saying that, you know, those who know better are local organization, and we should empower. As far as I'm concerned, I think that the reality lies in between, and we should. And I think the pendulum now is swinging back a little bit to where it should be. I think we have complementary. We have complementary strength, because if you push too much the pendulum towards the localization and saying those who know better are the people there and the local NGOs and so on, which is some things you hear sometimes, you know, we should let those people do because they know. It's true, but strengths are best combined. Because, for instance, if I take again the issue of conflict, it's true that working in conflict situation is a bit of a different way of doing things, because things that apply in natural disasters don't necessarily work in conflict, because you have security concerns and so on. And there, I have to say that an organization like the ICRC, you know, myself, I have most of my career in conflict zones, so there are things that I have learned along the way. But I would certainly rely very, very heavily on local wisdom. So, and here I'm fortunate to be working for the Red Cross, and therefore I have, you know, in the Red Cross, we have two sides of the same coin, which is the international side and the local side with the National Red Cross Society. And I think this is where the strength is really to combine the know-how and access to donors that big, large international outfits have, international NGOs, international organizations, with the know-how of the local people. So that's what we do in one province is not necessarily what is needed in another province. So I think that the localization sort of discussion is now progressively heading where it should be, which is localization, yes, but let's work together. Let's combine our strengths to make sure that we have the best possible outcome. Thank you.
Thank you, Mr. Faite. Would any other speakers would like to comment on this point?
Yeah, I'd love to jump in there. You know,
yes,
I definitely agree with what some of Alexandre has mentioned. You know, I think that that the role of youth and the role of women within, you know, peace processes, the role of youth and women within society and decision making is something that there's been global commitments to achieve. That's the Youth Peace and Security Agenda, the Women's Peace and Security Agenda. So these are established through UN resolutions, which governments have bought into. And I think it's about putting that into operation. For example, in our practices in Myanmar, we have worked in really close coordination with the government and the ministries to establish youth councils where youth can really, you know, put forward their needs into development planning. And I think that that builds a coordination between authority and community. And, you know, it's very important that we recognize that youth are not only, you know, the beneficiaries of rights, but they're rights holders, so that they need a voice at the table. And I think that that's something that is really important to draw out. On the issue of localization, you know, I think that definitely for Christian Aid as a partnership-based organization, there are two things that we want to focus on at the moment, which is localization and decolonization. And I think that these are really mutually reinforcing. So while our interventions are based on really rigorous context analysis, so understanding the environment that we work in, ultimately it is local civil society groups, CSOs, and local communities that better know that the needs that they have. Yes, we can provide technical expertise, and yes, we can, you know, work to achieve funding from international donors to support that. And they can work with local ministries to make sure that those approaches are both joined up. But ultimately, the needs and the driving force must be from, you know, from the ground. This can't be decisions made in Europe. I think they have to be decisions that are made in consultation with local communities. And for me, I think that that means that the role of youth and the role of women comes further into the conversation. because traditionally they've not been included in peace processes or in decision-making structures. So we do see a kind of a shift in that internationally. And I think that where that has been done well, we've seen that peace and peace agreements have been much more sustainable, where we've had long-term dividends to peace. And ultimately that allows, reduces humanitarian need and allows development to take place. And that's a win-win for the state and for the people and for INGOs. So, I think that kind of consultation is really crucial.
Okay, no, and that's Quinn. You actually mentioned something about vaccine justice. I have two questions. One question is coming from me, and the other question is coming from the audience. Let me finish the two questions. You mentioned about vaccine justice, and which leads me to think whether or not a structure such as COVAX is working, right? And then this is being followed by the question what the two of you has been saying earlier, just a minute ago, and then the follow-up question from the audience is that I'll just read it out if I may. It says, it is interesting to see that the pandemic has broadened many states' idea of security beyond the traditional idea of national security to national security, international security, and human security. Do you foresee a trend of a more localized, regionalized humanitarian assistance, or a more international and concerted effort? Would it be wise for nations to split their efforts or to invest more in more than one or the other? So that's the follow-up question. My take on this question is that there has been almost a natural evolution of how people see security. And now because of COVID-19, there are both, as Mr. Faite, I believe, has mentioned about the international perspective and the local perspective. So there are people who sees that, look, international is the way to go. While there are also people who are saying, look, we have to localize more. So which direction do you see that there is an emerging trend on this?
For me,
I'm open.
Yeah, so
Please.
For me, that there is a really key issue. This is not a question of either or. I don't think the pandemic has posed a global challenge, and it is a global crisis. So a response needs to come at the global and international level, where states can agree on a path forward. But also, the problems as they exist are real, and they affect the day-to-day lives of individuals. Millions have died as a result of COVID-19, and that's before we, just as a public health crisis, before we take into account the implications for society, for peace, and for social cohesion in very challenging environments. So I don't think this is an either-or question. I think the issue of vaccine justice sits with the fact that that we still see rich states being provided for first, and that is not in line with the kind of ethos of the SDGs or the idea of leaving no one behind. And I think that that's a question that the international community has to ask of itself, because that is real injustice at play. I think beyond that, when we look at the international efforts, we've seen, really positive things and momentum happen. But ultimately, I think humanitarian assistance will take time. And to reach, for everyone to have the opportunity to be vaccinated will take time. And that even is just within, states, let alone in very marginalized areas or borderlands, or maybe regions where states don't have full control at the moment. So I think that, that it is both a national and a local, or a national, local, and an international challenge. And those kind of dots need to be joined up in order to make sure that we do address needs. And I think that there's a real positive reason to address that. because we've seen the evolution of the virus over the last year and a half. We've seen different strains. So this will be a challenge that affects everyone in the world. You know, it's a great leveler in that way. And for everyone to be vaccinated, ultimately, this is real interdependence at play, where, you know, we all benefit equally by, you know, the world being more resilient to this.
Yeah, what you're saying, Dr. Quinn, is interesting. And actually, I'm addressing this to Mr. Faite, because as you're saying, that it's not an either-or proposition. There are actually people like Mr. Faite and his colleagues who are actually bringing international assistance into local areas. But the reason why he's bringing international assistance into local areas, because if he does not, it may not, the local people may not be receiving any assistance, because basically there's no national support, or there's no national mechanism that exists to support the local people. And that's why Mr. Faite and his colleague has to go in through the International Red Cross.
Look, Doctor, if I may answer to this, I agree with Dr. Quinn that it's not either or. And as I said in my answer to your previous question, I think it's in the situation of conflict, especially, it is important to combine both. Because sometimes communities are disfranchised. I mean, that's the reality. That's why you have a conflict in the first place. You have people who are, you know, there is a problem. There is a problem. So hoping that communities will do the right thing necessarily is not always warranted. I'm speaking in a very sort of a candid way here. So I think it's a combination of both, and it's true that local, and for us, you know, I can't say enough how much I like working with the Indonesian Red Cross. They have a tremendous network of volunteers in every remote island. You have PMI, okay, so they know far better. But I think international organization bring in something on advocacy, can mobilize the donors, can bring things under the spotlight, have sometimes access even to national authorities. So once again, I think, and I'm very pleased to be here today, Doctor. I'm very pleased to have been invited by IPR, Institute for Peace and Reconciliation, because it's it shows that, yeah, perhaps the voice of the ICRC does matter, and how it works with its local counterparts. So now, but I do agree that in the past we perhaps did not listen well enough. There has been a time like this, you see, but I think now we are really hopefully going where we want. Now, very quickly on your second question, which is COVAX, whether COVAX is enough. Well, I think everybody knows it's not enough. And this is why, for instance, ASEAN has come with this important donation recently for Myanmar to sort of supplement what COVAX is doing. So it's not enough. And even if it were enough, we have to keep in mind that vaccines are only one part of the problem, because vaccination remains afterwards, and vaccinating a country, vaccination in a country which is confronted by conflict, for instance, it's a big challenge. So no, I think there is a long way to go in terms of saying that COVAX is not perfect, but okay, maybe it's the first time, and we improve by doing. But there is also implementation of vaccination, which is a huge challenge, and hopefully we'll get over it. Thank you.
Thank you. Ms. Nanthini, would you like to jump in here before we move on to the next question?
Yes, actually. So on your first question on localization, yeah, I completely agree with my other two speakers. Here you have, definitely it's a case of both. You can't only have international organizations or local CSOs, you definitely need them both. Especially, I think, for a very practical reason, is that these international organizations, as Mr. Faite said, a lot of them, they have technical expertise, they have funding, they have contacts. There's some real advantages here with working with international organizations. But at the same time, most of them tend to have quite high turnover rates. And that's where you kind of want to rely on those at the local level who have that local knowledge, who are day in, day out. They aren't moved around as much, maybe, in that sense. So definitely both. And for the COVAX, I mean, yes, of course, COVAX has not been enough, and there's definitely this sense of gap in who is able to access these vaccines. Definitely, there's a lot of vaccine nationalism taking place. I mean, already in Southeast Asia, there is quite a gap between countries like Singapore. I think right now Singapore has over 80%. We have vaccinated, I think, almost 80%. No, more than 80% of our population. And then you have other countries which much less. In fact, now Singapore has moved on to delivering booster shots to our elderly populations, and that's another problem as well in the region, where if I'm not wrong, countries like Thailand, Indonesia, Philippines, where there's still a gap in terms of not everyone has already getting their first shots. People in power, people who have the advantages, people who are richer, they have been already trying to get booster shots, even when maybe that's not what the government plans. So yes, definitely vaccine nationalism. There is definitely a gap there, for sure. But fingers crossed, hopefully.
Thank you. Moving on to the next question from the audience. I'm not sure how you would want to respond to this. This is the question. What are the speaker's thoughts on government programs to speed up vaccine distribution that involves scientists and medical professionals to ensure that vaccines reach all communities without exception? So again, my interpretation of this question is probably should the politicians, the civil servants be running it, or should we put it in the hands of the scientists and medical professionals to ensure that the vaccines go to the people who would need them? Who would like to comment on this?
I'm happy to respond on that. I think inevitably this is another case where there are two sides to this coin. I think there is a key role for medical staff in direct implementation, in delivering the vaccine and having trained people to deliver that. And there's also a role for the state and for governments in developing policies to roll out vaccines and to make sure that they are made available for people to receive. I think that for organizations like Christian Aid, where we work on humanitarian aid, where we work on development and on peace building, I think that for us, it is a really crucial thing that there is support from the state for vaccines, and that's not the case in all countries. So, we need to be able to work with local municipal governments and local leadership structures to make sure that it does access everyone. And where states implement policies where they want everyone, regardless of ethnicity, regardless of where they live within a country, including internally displaced people, where policies actively seek to provide the vaccination to them, I think that's a really positive thing. But inevitably, I think that, trained professionals are also absolutely key in delivering the vaccine and making sure that we have staff who are capable of doing that.
Yeah. Any other comments from the speakers?
I think, if I may, very quickly, I think I agree with Dr. Quinn. I think that the medical, the health sector and specialists have their role. But as I said earlier, once you have the vaccines, it remains to do the vaccination. And I think that here, all sorts of people have an added value. If you take the case of Indonesia, which has 30,000 plus island, how do you go and vaccinate? Here it involves logistics, it involves all sorts of know-how, not only health know-how. So health know-how is crucial, of course. You want to do things in a professional way. You don't want to do things which wouldn't be vetted by the health department. But logistics, how do you vaccinate in Papua, which is a jungle where sometimes there are problems? So no, I think here that I wouldn't vouch for something which is actually run by the health scientists only. I think again, combination of skills, combination of strength is the way to go. Thank you.
Thank you very much.
And I agree as well. In the sense where you would want the people who are experts in medical health actually administrating the vaccines to you, making up the health policies, the vaccination policies, who can get what at what time. You would definitely want scientists and doctors and all that in charge. But in terms of government, in terms of, as Mr. Faite says, logistics, you would need the not just the national government, but also the support of the local governments and the municipal governments who actually endorse these vaccination drives. Because again, without government support, without government endorsement, it's going to be very hard to actually put on any sort of effective, sustainable vaccination drive, for sure.
Yeah, and thank you very much for the responses. If my interpretation of the question is correct, actually, the person who asked the question was airing his or her frustration on how things are working or not working, probably, and that's the reason why the question was asked. I have one more question before we go to before I ask each of you to make some concluding remarks, and I would like to pick on the point that was raised by Mr. Faite with regard to the local Red Cross volunteers. Do you think a structure such as this could serve as a model for other areas of social work? We know that in Indonesia, having the local Red Cross volunteers helped a lot in making sure that help gets to the people who need them. And we mentioned about the many social problems that people in this part of the world and other parts of the world as well are facing. Domestic violence, to name a few. Would a structure such as the Red Cross, the local Red Cross volunteer, can it be imitated in other areas of social services?
Well, yes, I think so. And I think if I take the example of National Red Cross or Red Crescent societies, they do so different things in the various countries where we all live. And I'm sure we all know them, but they do very different things. I'm myself from Belgium. There was big floods in Belgium, and of course they sort of sprang into action when people's houses were flooded. You may have seen it on TV. Germany and Belgium were flooded. So this is something, but they can do all sorts of things, which in our case, we link up with them mainly for conflict, but they can, in other places, they can be associated with other things. Now, when it comes to outside the Red Cross movement, we try also not to limit ourselves. We don't want to be exclusive, like a small club and only work among ourselves. We try to expand a little bit because sometimes it has been seen as being too closed. So we try to reach out more than we have in the past, and I think here. There are, all sorts of excellent organizations which are doing a fabulous job. And I come back to my motto, which is we need to combine our strengths, which are very different strengths, and unite them for the better. Thank you.
Thank you very much. Any comments from Professor Quinn, Ms. Nanthini on this point? The local volunteers?
No, please.
Oh, okay. Dr. Quinn, please.
Thank you. I think from our side, obviously we work directly with in partnership with local civil society organizations. And that means working, with local power structures that are trusted, with people who are deeply embedded in local communities. And that involves inevitably people who are giving off their time and their resources. And, I think that that's something that's absolutely crucial because these are trusted figures within communities, and I think that means that we are a lot more connected, and that means also that we work, outside of silos. Joining the kind of humanitarian work that addresses the needs of, people in refugee camps, the people who have been displaced by conflict and internally displaced people, but also I think it allows us to identify the needs, development needs, and to begin integrating them into humanitarian response, but to make sure that humanitarian actions are also conflict sensitive, so that they're not going to continue to evolve the conflict. So it requires a great deal of listening to people on the ground and to make sure that our efforts are joined up.
Thank you. Ms. Nanthini, you were going to say something?
Oh no, I was pretty much just going to repeat in the end what Dr. Quinn and Mr. Faite has already said. Thank you.
Yeah, thank you. Another reason why I raised this question was because as I'm sure all of you are aware, that Indonesia is one of the countries who implement what is called the conditional cash transfer policy, which is a form of social safety net, and also helping to ensure that there is a relatively good system of income distribution. So it is an experiment in quite a few countries, but Indonesia has been implementing it for some years. And they use a form of local volunteers as well to help the government distribute cash into the various families, and with children, pregnant women, make sure that the families receive the health care that they need and all that. So this is actually an interesting model as well. But what is very clear from what all of you are saying is that there is both, there are at least three levels, which is the local level, the national level, and the international level. Not only in terms of providing humanitarian assistance, but also in ensuring there is stability in the society. And once there is stability, there would be peace and harmony in the society. And also there would be improvements that are being made in the well-being of people. So with that, I would like to hear your concluding remarks or from each of you on how on what you would like to live to leave this session with some food for thought for the audience. Okay, so please let me start by Ms. Nanthini. Am I giving enough time for you to think, or are you okay?
Sure. All good. I guess what I would leave is that I think it's become very, very evident that governments, all these global institutions, humanitarian organizations, CSOs, everyone, they're very much caught off guard by sort of the reality, and I guess I would say that the scale of COVID-19. And one thing that has really become very clear is that there's this need for stronger planning and pre-arranged frameworks, flexible fundings to actually be in place, and especially now to address the prolonged impact of both this current pandemic and any future pandemics, crisis, which, whether we all like it or not, is most likely going to happen. Like COVID itself was predicted for a long time, and no one really, and now it's here. So I guess very much coordination is the fundamental point here to actually achieving this. And this is not just in the aid sector, but also just broadly throughout maybe a intergovernmental, with humanitarian organizations, private sector, CSO, communities, individuals, everyone has a part to play in this. And pandemics, it's a transboundary issue, and it cannot be solved just by one country or only by one sector. It definitely needs to, it cannot be addressed in isolation, and it definitely needs everyone to work together, I guess, to kind of have to address the many and varied unfortunate impacts of the pandemic and other future crises in this ilk. Thank you.
Thank you very much. Mr. Faite, your parting comments, food for thoughts?
Yes, look, I'll bounce for my closing comments. I'll bounce back on what you said about cash transfer, for instance, conditional cash transfer. Yeah, great idea, except if there is no market, because if there is no market, then you push the prices up. You bring money where supply is insufficient. So, and in a conflict situation, quite very often, the market is not sufficient. So conditional cash transfers can be the best of thing, but sometimes they can have an adverse effect. So this is perhaps one very clear example of how situations vary tremendously from one to another, conflict situation to others, and so on. So my two mottos would, I won't surprise you, I think, Doctor, to say that there is complementarity between international world and local world. It's not one or the other, and I'm happy that the pendulum is swinging back to some sort of more collaborative way rather than either or. This is quite clear, and I think all the speakers have agreed on this. And the second thing, which is a little bit the motto of the ICRC, in conflict situation, there is this additional dimension which makes things a bit more difficult, and this is why impartial, neutral humanitarian aid is very important, and it's very important to ensure. And here again, I think the complementarity is the way to go if we want to enforce this particular level of implementation. Thank you.
Thank you very much. Dr. Quinn, please.
Yeah, I think I'd echo many of the things that have already been said. I think your point around social safety nets is a really crucial one. And I think there are repercussions for the kind of political change that we've seen in recent during lockdown with in terms of Afghanistan or Myanmar and the implications on banking, which I think is something that we haven't really talked about through the lens of social cohesion, but is inherently linked to COVID-19. But beyond that, I think that we have to recognize that there are really strong links between peace, development, and humanitarian work, and that the stronger the relationship that can be built between communities and government helps deliver on that. And I think for organizations and INGOs, I think there's a real opportunity to learn, and governments alike, to learn from the implications of COVID-19, to learn that we need to be able to adapt, to really recognize what is working and not be fixed on one way of doing things, but to adapt to things that will be more effective. And I think finally, I think the COVID-19 pandemic has really highlighted the need for macroeconomic policies that address the needs of the most vulnerable and provide, that address the real root causes as well as the drivers of conflict. And I think that that's something really important moving forward to build back better.
Thank you very much. What I gathered from your concluding remarks, if I may make some myself, is that this is the time where this part of the world, and I'm sure other parts of the world as well, would need to combine their strength, as Mr. Faite has put it, and also to give emphasis to the complementarity between international and local efforts. And through that, we will be able to ensure that there is peace and harmony in the society. And because of that, it will lead to peace in the region as well. So if I'm wrong in making those concluding remarks, please please let me know. But that's the thinking that I get. I think the the bottom line of what our three speakers has been saying. Okay, so with that remark, I would like once again to thank our distinguished speakers, Ms. Nanthini from RSIS, Mr. Faite from the ICRC, and Dr. Quinn from Violence to Peace. We are deeply honored that you kindly spare the time to join us at this webinar. And I do hope that once we invite you back, you will come back to share your views again with us. Thank you very much.
Thank you.
Thank you.
Thank you very much, everybody. Great session, very interactive.
Yes.
Thank you, Dr. Darmp, for moderating this afternoon's discussion. And thank you as well to our distinguished speakers for their time, for sharing their experience, their expertise, and for answering the question posed by the audience. Excellencies, ladies and gentlemen, we have come to the end of the fourth session of the ASEAN-IPR Discussion Series 2021. We express our sincere appreciation to all attendees in Zoom and the viewers on YouTube who have followed the discussion from beginning to end. You can review the discussion that has taken place this afternoon on the ASEAN-IPR's YouTube channel. Lastly, we would also like to express gratitude and appreciation to the Embassy of Ireland and Embassy of Finland in Jakarta for the generous support towards the ASEAN-IPR discussion series. We hope you'll be able to join our next discussion series session. In the meantime, please stay safe and healthy. Thank you and good afternoon.
Thank you, everyone.
Thank you very much.
Bye-bye.